One of the greatest challenges that we face is accessibility to medications for our patients and for the members that come see us here at the medical center. That 1 out of every 3 of our patients was non-adherent to their treatment, meaning they, for whatever reason, could not access their medication. They did not pick up their initial prescriptions or a refill. And so we recognized very early on that that tied into healthcare outcomes. We recognized that patients that were not adherent to their medication therapies tend to have a negative impact on their overall healthcare.
What we found with our patient group is if patients fill at a retail center, they typically are not picking up around 30 to 33% of medications. Once we implemented ASM into the prescription program, our enrollment rates are actually through the roof. Right now, on average, 1 in 2 patients are actually signing up for the dispensary, which is pretty good. We've had high success with implementing this program. Patients are on board, doctors are on board, 10, 15% month-over-month growth for the last year.
The idea is how can we ensure patients have access to medication? How do we ensure that patients' access to medication is mindful of our patients from a cost perspective, from an access perspective? And so being in alignment with AS Medications helps us as an organization drive that point home.
I think the cool thing about having medication on site is we control the formulary, so we know what the insurance will cover, what they won't cover. A lot of times when you send medications out, the doctor has no idea how much the medication costs. They don't know if it's on formulary. They don't know even if it's available. Because we have everything here, they're starting to learn, hey, this medication is super effective. It's much cheaper. It's always covered. So I think that's like the biggest thing with this whole program is you get to tailor prescribing habits, but you also get to stop issues before they even happen.
Being able to treat my patients on site is something remarkable, something that in a perfect world, what should be the standard? This way there is no waiting. Patients do enough waiting in the waiting room, and there's no better feeling than going somewhere that's a one-stop shop where you can come in, get your treatment, and get your medications, and go back home.
Prior to us implementing the provider dispensing here at Sanitas Medical Center, Net Promoter Score somewhere hovering around the high 60s, mid to high 60s. And so we wanted to understand what is it that we could do as a healthcare organization to bridge that gap. I will tell you this, in implementing the dispensing solution through AS Medications, we saw across the board at sites that were dispensing medication, that were actively engaged in this program, NPS scores anywhere from 2 to 8 points higher. We have patients that will directly relate the quality of their visit, the positivity or the positive experience of their visit to the fact that they were able to access medications in real time at the medical center. And so when we start seeing that in our patient satisfaction surveys, we start to recognize as an organization, hey, we have something here. We have something that patients truly value.
I would recommend using ASM with other centers because for us, we went from 0 pharmacies to 17 pharmacies in 1 year. Obviously, that's substantial growth, and without a partner like them, we would have never been able to do it. Every single rollout, they were on site, helping us, training, setting up the medications. They were also helping with like inventory levels, different marketing materials. So having them was the main reason we were able to grow so fast.
The relationship with AS Medication and Sanitas really helps us stand out in the market. We truly have a solution for patients that mitigates them leaving our ecosystem. It really drives us as a separator, as a differentiator in the market. We're seeing it both from a clinical perspective and from a financial perspective. The results that we are producing today versus prior to us having AS Meds partner with us in this journey are extremely palpable. And we're very excited for where we're at today and the future that's ahead of us.